Good day, dear friends, dear colleagues. My name is Professor Mughis. I'm head of plastic surgery department at Qaid-e-Azam Medical College, Bahawalpur, Pakistan. First of all, I must say thank you to my hosts who have invited me for this lecture in the basic course of ISHRS. These are difficult times. I always love to attend all the meetings of ISHRS to meet my old friends, to make new friends, and to learn a lot from you people. But unfortunately, this year things are different, and due to COVID, we cannot meet. Today, the topic which I have been given is anesthesia in hair transplant surgery. Doing hair transplantation is an art. It's a simple procedure, but a lengthy procedure. The patient who comes to you, he had a lot of fears. He had a fear of surgery. He has fear of pain. He has fear of anesthesia. He has a fear of operation theater. He has fear of complications of the surgery. And we have to keep in mind all these fears which patients usually have, and we have to address each and every issue. The first step with which we start our hair transplant is anesthesia. So if our anesthesia goes pain-free, in a painless manner, the patient will remain comfortable, you will have a good, happy patient, and a good outcome of hair transplant. But if you have a very painful experience from the start, then I think that gives a bad impression to the patient. The surgery also becomes tough and difficult. So, pain-free surgery is the goal. Whenever a patient comes to you, we have to keep a lot of things in our mind, and this is how we proceed. We take history, we reassure the patient, we have to make him comfortable and relax, we have to make him anxiety free with medication, we have to give him sedative, we have to do some other tips and tricks like numbing cream, vitals, different kind of needle and syringes, which I'll come later on this topic. We have to use vibration so that his tension is diverted, diluted local anesthetic, which is less painful, and the role of nerve blocks in anesthesia. When a patient comes in your clinic, you must take a detailed history, including all kind of health issues, medication he is taking, allergic to any drugs or no. You must observe his hesitation, his concerns. You must see how nervous the patient is, how sweaty his hands are, and you have to reassure that patient. The more nervous he is, the more nervous he go into the operation theater, the more trouble he will make for you. So keep him calm, keep him relaxed, and keep him pain-free while doing the procedure. And anesthesia, a good anesthesia is a key to that. When a patient is going into the operation theater, you have to make the atmosphere and the things around him more relaxing, more romantic. The atmosphere of the theater should not be like a theater. It should be like a cinema hall. There should be light music going on. The temperature should be comfortable. The transplant table should be very soft, comfortable, where he can relax easily. And you should use a lot of soft body positioner so that he does not get tired during the procedure. So the atmosphere is very important. I usually give anxiolytic to my patient, tablet Enrol 10 milligram a night before, so that when he comes in the morning, he is relaxed. And if you give it the Enrol a night before, it does not react with other medication which you give during transplant. I usually give a sedative. Midazolam is a wonderful drug, 7.5 milligram, 30 minutes before the procedure. That actually acts as a sedative as well as it causes a transit anesthesia. So you don't remember the needle prick which the patient gets. And a single dose of antibiotic, and I always maintain a IV line. So make sure that you make a IV line throughout the procedure. So in case of any emergency, you should have a IV access. I apply a local anesthetic cream with 10% lidocaine on the donor sides as well as on the recipient side area. I apply it at the nerve block areas on the forehead from where supraorbital and trochlear nerves are emerging, and on the back where greater occipital and lesser occipital nerves are coming out. And I keep this anesthetic there for like 30 to 45 minutes and apply a thin plastic sheet over the local anesthetic, and that actually makes its effect more pronounced and more effective. And this actually makes the needle prick, painless. There are certain other small tips and tricks which I usually use. I use a lot of vibration device, and I always keep the vibrating device just next to my needle, and the patient feels the vibration but not the needle prick. The needles which I use are very fine, that is like 30 gauge to 32 gauge. The smaller the needle is, the less painful it is. And I use small caliber syringes. The smaller the syringe, the lesser the pain. The bigger the syringe, the more the pain. Because of the pressure the bigger syringes generate. For anesthesia, I use numbing cream in the beginning, which numbs the skin. Then I use diluted lignocaine because diluted lignocaine is less acidic as compared to pure lignocaine. Pure lignocaine is very painful because of its acidity. When I have injected the diluted xylocaine, I wait for like 4 or 5 minutes and then I fortify my injection by pure 2% xylocaine. In my fluid, I routinely use xylocaine 2%, epinephrine in dilution of 1 in 1 lakh, and normal saline. In hair transplantation, when we have to reduce the dose of local anesthetic, we must know the anatomy of nerve blocks. So this is what I do. I routinely block my nerves first, because after blocking these nerves, a huge area of the scalp becomes numb with a very small amount of local anesthetic. So on the donor side, I numb my greater occipital, lesser occipital, and post-auricular nerve. And on the frontal region, I do my supraorbital, supratrochlear nerve block, and which actually literally freezes the whole of the scalp. And then the patient remains very calm, and he does not feel any pain of needle prick. And after that, I give fortifying injections of ring blocks, but they are actually totally painless, which I will show you in the video.
Prepare the donor area for FUE or strip harvest. We give greater occipital, lesser occipital, and posterior auricular nerve blocks so that the dose of local anesthetic is reduced. 1 centimeter lateral to the occipital protuberance, there is the greater occipital nerve. Further 2 to 3 centimeters lateral, there is the lesser occipital. And further 2 to 3 centimeter in the post-auricular area is the posterior auricular nerve, where we inject our diluted local anesthetic. After that, we fortify our injections with pure xylocaine, and then we freeze the rest of the donor area. By giving these blocks, we make the patient very comfortable in a very limited amount of needle pricks and limited amount of local anesthetic. And the patient remains very comfortable, and we don't have to inject a lot of local anesthetic. Thank you very much. Supraorbital and supratrochlear nerves are very important for the frontal recipient side block. By blocking these two nerves, you make the patient really very comfortable. Palpate the notch in the supraorbital bone and mark it, that is the supraorbital nerve coming out. 1 centimeter medial to supraorbital nerve is the supratrochlear nerve. And these two nerves literally block the whole of the frontal forehead and scalp of the patient. And you put a very small amount of local anesthetic by blocking these two nerves, and then you can easily and comfortably freeze the recipient side of the patient. You should use very fine needles, and I usually use 30 gauge very fine needles for this purpose, and that actually makes the patient very comfortable. And after that, injecting this diluted tumescent fluid, then I reinforce my blocks by local anesthetic. And then I give small doses of local anesthetic at the hairline as well to fortify my blocks. This is the way I give supraorbital, supratrochlear blocks. And then I give small doses of local anesthetic, that is xylocaine with adrenaline, at the hairline. You can see how effective the frontal blocks are after putting supraorbital and supratrochlear frontal blocks with a very minimum amount of local anesthetic. The whole of the upper frontal scalp is numbed and you can easily infiltrate your fluid without any pain and discomfort to the patient.
Throughout the procedure, you have to be very vigilant and careful. One person should keep monitoring the vitals of the patient. If possible, a cardiac monitor or a ordinary vital monitor should be attached all the time to the patient so that you are monitoring the patient. And if you feel any signs, symptoms of any complication of local anesthetic, you are able to manage it as early as possible. As early as you pick the symptoms of the patient, the treatment is easier. But if something serious happens, then managing the patient is difficult. Every drug, every medicine, every injection, every procedure has a complication. Hair transplantation is a safe procedure, but you must know the complications of your local anesthetics and medications which you are using. There are two types of complications which can occur. One is the nervous system complications and other related to vascular system complications. Usually the complications which occur in nervous system are tremor, weakness, sweating, and sometimes fits. So what I usually do is I give a sedative to my patient. And these sedatives are really, really helpful in avoiding these nervous signs, symptoms, and complications of local anesthetics. And for vascular system complications, the usual complications are palpitations, tachycardia, arrhythmias, dizziness, faintness, hypotension, cardiac arrest. So when you are monitoring your patient, you see all these things. If you see there is tachycardia, you should try to calm down the patient. Okay, and you can usually I give tablet Indrol one night before. That actually keeps the heart rate low. And for hypotension, you should have an IV line access to give fluids to the patient, keep the patient lying with foot end raised. For cardiac issues, if you identify these signs symptoms early, you will be very comfortable in managing any of these complications. Your operation theaters should be well equipped. You should have cardiac monitor for monitoring. You should have a defibrillator in case of any serious complication like cardiac arrest. You should have oxygen supply, oxygen cylinders or central oxygen supply. You should have intubation equipment in your operation theaters. And I think that all the persons who are performing any surgical or non-surgical procedure on the patient, they should do their BLS or ATLS course for the safety of their patients. I hope this small talk will give you an inside out of how to do local anesthesia in hair transplant surgery. Thank you very much again for inviting me here for this lecture, and best of luck for the year coming ahead. And be safe, be happy. Thank you very much.